Hi friends, let's talk about CRPS today, chronic regional pain syndrome. This is a very complex set of symptoms that I wanted to go over with you. If you like different types of medical topics, maybe mishaps and problems that can occur and errors that can occur, such as this last one that I did, then stick around. Please listen. If you enjoy this kind of content, please give it a thumbs up and consider subscribing. Complex regional pain syndrome, or CRPS, is a set, that's why it's called syndrome, of complex symptoms that a patient can have. And regional is because it's usually in one region of the body, but not always. And it's usually limbs, like arms, legs, one arm, one leg, both legs. Pain, because it is intense pain. People who have it describe it as a 10/10 pain. So CRPS has these characteristics about it. Pain is intense. The description of the pain is usually burning, tingling, pins and needles, really increased sensitivity to anything, even if it's just a splash of water, a light touching, a cotton ball, something like that is just excruciatingly painful. So you've got this increased sensation, this burning numbness, sometimes weakness in that limb, sometimes tremors, sometimes skin color changes. And these people have difficulty with sweating, difficulty with the hair growth in that part of the body, and even a change in their hair growth everywhere and their nail growth. Just some very unusual but specific sets of symptoms. This can be diagnosed as CRPS1, which has no injury related to it, or CRPS2, which is related to an injury such as a motor vehicle accident, a crushing injury to a limb, surgery on that limb, or a break, a fracture, for example. But like I said, with CRP type 1, there is no injury to pin it to. And with what happens is the pain that you would get over from an injury or a surgery goes on for months and months and months and does not get better. In fact, it gets worse. And then if prompt attention to CRPS resolution is not implemented, it can progress. In some extreme cases, it can go inward, where then people who've had it for quite some time, it can go into abdominal pain, intestinal pain, pelvic pain, in areas like that. It is considered that the nerves, starting with peripheral nerves, are damaged, injured, or in some cases, there is no area that we can say that was damaged, that's why this has set in. But those nerves have become damaged for some reason and have developed into a imbalance of the pain receptors to the brain. So the nerves and receptors that carry pain to the brain are not working right and are much more sensitive. So the goal is to put the balance back in place, so to speak, into this oversensitization of the pain receptors to the brain, how the brain is processing the pain. Recovery can be slow. It can be very slow. And it also can go on for a very, very long time until the person has come to a place that specializes in CRPS. The person finally gets a proper diagnosis, gets to the right place, and gets the appropriate treatment. Usually, this syndrome occurs within about 1 month, give or take, from the injury. So what is the treatment? Getting to the appropriate place once you have a diagnosis. I guess I should back up. Where would you get your diagnosis from? If you go to your doctor, you go back to your surgeon, they're not going to probably diagnose you with CRPS, although maybe they would. But more than likely, they're going to send you to, say, a pain specialist, a physiatrist, PT, OT referral to try to help with that limb, with that pain, with that limb injury. But it really should start with a pain specialist, a doctor who specializes in this type of syndrome and knows about it, understands about it, and can help the patient get on the path of recovery. Because it's going to be a different type of physical therapy, for example, than somebody who's not being treated for peripheral nerve pain. So prompt treatment, getting to the right provider who can help, is key. And besides some physical therapy, good nutritional diet, and the proper medication is something I wanted to talk about. So what medications are those? And the reason I'm even talking about CRPS is because I wanted to do a video on the Maya Kowalski trial and the multi-million-dollar medical negligent lawsuit that they won against Johns Hopkins All Children's Hospital in Florida. So this family won it, and they did go to trial. It was 8 or 9 weeks long. I watched the entire trial, and it had to do with her diagnosis of CRPS. So when I talk about medications, it's generally not what she got, which I feel like really kicked off a lot of problems from the very beginning when she got into that hospital. Because at that time she was being treated with ketamine, and she was being treated with high-dose ketamine for the pain after she was diagnosed with CRPS in her lower legs. And this is a 10-year-old at the time. So she was also being brought to Mexico to have coma-induced ketamine therapy. But that's not the norm for medication treatment. So since it's a nerve pain situation, it would be medications like gabapentin, for example, that treat nerve pain. And it would be things like steroids or anti-steroidal medications to help with the inflammation that's going on, that's contributing to it. A lot of times they do nerve blocks, and also they do a lot of topicals. So there are good alternative therapies that are used that make a difference, and that would be something like biofeedback, support groups, feeling less alone in all of this, mental health, getting some mental health therapy from someone who specializes in chronic pain management for people who have to live with this or who are going through several weeks or months of this chronic pain. It's not that narcotics are never used, but it's just that ketamine, for example, or other narcotics are not the norm for treatment of CRPS. It's the other medications that I mentioned along with other types of therapies. Amitriptyline is also another one that I see, that I've read about, that is used in the regimen. It's not just one medication. It's lots of medications. It's lots of support. It's pain management from the right team, all put together to help. So my sister was diagnosed with CRPS after she had surgery on her arm. And her surgery started here on her thumb and was up to her elbow, and it had to do with nerve surgery with this nerve and this tendon. So shortly after that, she developed swelling, discoloration, and intense pain in this part of her hand where she had surgery. Of course, she went back to the surgeon, who said, "I'm done with my part. I've done surgery. Everything looks good. You're healing fine. I guess you could get a hand physical therapist consult." So she did go to the physical therapist. She eventually did get a diagnosis of CRPS, and the hand therapist is who started her on the desensitization treatment that had to do, for her case anyway, a cotton ball softly and many times throughout the day, different, because you're building up that sense. It's painful at first, it's so sensitive at first, and then over time, you're building up a tolerance to something that normally would cause such excruciating pain. In addition to that, her provider had her start gabapentin. So she continued with the exercises with hand physical therapy, desensitization, and gabapentin. And it took a long time, but that she got a resolution to see active CRPS. She did not get a resolution, though, to much movement in this thumb like it used to be. But the CRPS is not an issue anymore. Some providers feel that CRPS is always in you and something will activate it. I don't know, but that's, like in the case of Maya Kowalski, that's what her CRPS specialist says. She will always have it. She's not on ketamine anymore. All of that, she got weaned off that when she was at Johns Hopkins All Children's Hospital. They implemented other types of therapies for her. And it's taken me a long time to put that together, because if you didn't see it, it is an extremely interesting case, heartbreaking case, and complicated case. But it resulted in the family winning against a prestigious hospital unit and medical center such as Johns Hopkins. I forgot to mention another really interesting alternative therapy that seems to work for people, and it is called mirror box therapy technique. I found some really good, a couple providers that seemed, I guess that there are some places in the country that are better than others for treating this. You can do your own research. I can certainly list below what I found that I thought, if my sister's continued, I certainly would be bringing her there. So again, back to some facts about it. It is a condition that kids and adults can get. It is a chronic pain condition, usually regional, usually limbs, but not always, can progress to the whole body. It has to do with nerve damage and injury. And when that nerve is damaged and injured, it's a autonomic nervous system dysfunction and inflammatory response. So I hope this was helpful. I hope that whoever is out there that maybe has this or thinks they might have this, to please not give up, to talk to your provider, talk to whoever you can find that will help you with this, because there are treatments for you.